Hello everyone, my name is Kirsten Tingle, and today I will be speaking about a rotator cuff tear in badminton. So the objectives for this video are to discuss the rotator cuff and its components, such as what muscles it's made of, to discuss the mechanism of injury, and to discuss the rehabilitation specifically for a badminton or a racket activity player. So we're going to start off with the rotator cuff anatomy, and on the front view you can see the subscapularis, which is deep, the infraspinatus, which you can actually palpate and feel on the back, and the supraspinatus. On the back view, you can see the teres minor, which is also a contributor to the cuff. So the injuries that most often occur to the rotator cuff occur on that supraspinatus that's on the top, and it disconnects from the humeral head. This happens because of overhead movements such as the smash that you can see all the way to the right, where these players are taking their arms way back behind their bodies and throwing their shoulders forward, which is not a very advantageous movement for the body. So after an athlete has torn their rotator cuff, specifically their supraspinatus, they will usually undergo surgery because it's hard to work around that because it does get involved in a lot of your sport activity. So when they go in for surgery, the surgeon will clean the humeral head and clean away some of that torn rotator cuff, as you can see on the bottom left. They'll insert screws that you can see in the top picture into the bone that have these strings off of them that will become sutures tying the rotator cuff tendon back to the humeral head, as you can see in the middle and last pictures on the bottom. Following surgery, patients are put into a sling that can either hold their entire arm to their body, as seen in the far right, or that will just hold the elbow and the forearm with a crossbody strap running to the other shoulder. Following surgery, patients will go into rehabilitation oftentimes the very next day. An important thing to remember with rehabilitation is that no two patients are the same, especially in a sport like badminton, where ages 5 to 85 or beyond can play. However, the goals are always going to be the same, where we're going to want to restore that range of motion in the shoulder, to strengthen the other muscles to compensate for the tear in the rotator cuff, and return to play for athletes especially. So rehabilitation of the shoulder following a rotator cuff injury and surgery begins right after surgery. This rehabilitation is broken up into 4 phases and is not as time restrictive or constrained by time as other rehabilitations may be. In this first phase, we see exercises such as pendulums, stick external rotations, active range of motion of the arm and other joints besides the shoulder, grip strengthening, tabletop warm-ups, and shrugs. And the goal overall is to stretch the muscles to regain this range of motion that could be lost due to scar tissue and prevent the buildup of more scar tissue that could limit the motion even more. So in this video, we're going to see the pendulums that I will go to first. You can see the athlete has bent over at the waist and is just letting his arm dangle so that it's just a nice and easy stretch in the shoulder and the back of the shoulder and on the top of the shoulder where that surgery will have just occurred. The next exercise is this stick external rotation. And you can see the athlete has a cane or a broomstick or something of the like, and they are using their active arm to push their injured arm into external rotation, but not very far as rotating towards the back. So they just want to get a little bit of that rotation back in the shoulder. The next exercise, we're going to see some active range of motion in other parts of the arm, including the elbow, the wrist, and the hand. And you can see the patient has his shoulder close to his body, his elbow is locked into his side, and he is flexing that arm all the way through that range of motion from flexion to full extension of the elbow. The next exercise we're going to see is grip strengthening. In this, you will see that the athlete is holding a ball, and these balls can be different in the way that the pressure is applied to them. So some are easier to squeeze than other, and this is just building back that forearm and hand strength to increase the strength in the bicep as well by holding that arm in that position. And this all works to strengthen the shoulder as well as the overall arm. The next exercise is a tabletop warm-up, and you can see that the student will be bending over the table and gently rocking from side to side, trying to get a nice stretch in the shoulder. Nothing too far or anything that causes too much pain. We just want to get a little bit of movement without ripping any sutures out, just to make the workout following a little easier. The last exercise I have listed here are shrugs. And these are done without weight, and you can slowly begin to add weight. You can see the student is dropping his shoulders and then raising them up towards his ears, keeping his arms relaxed and controlled as he brings them back down. There are other exercises you can do in this phase, and those are just a handful that would be prescribed at this point. The next phase, phase 2, begins as soon as you're through that range of motion and those exercises. You progress into phase 2. There's no real timestamp on it. However, when you go into phase 3, there will be, because there's no internal rotation before 8 weeks. So back to phase 2, we're going to see table slides, some forward elevation with a pulley system, upright stick elevation and abduction of that shoulder, shoulder retractions or no many, which I will explain, and wall protraction and retraction. The goal overall is to reestablish, again, this range of motion and begin to strengthen those muscles a little bit. So to get a better idea of these exercises, I'm going to go ahead and search through this video. Use those timestamps I have there to show you exercises like the table slides, where you can see the athlete has placed the hand of his injured arm on a towel or a rag and has put it on top of a treatment table, and you're going to see that he's going to use his body weight to push that arm forward and get a stretch in the shoulder. This is again to start with some of that range of motion. It's not meant to cause pain, but it's stretch. You see he pulls back, and this is all done in a controlled manner, so again, we don't cause pain. The next exercise is going to utilize a pulley system. And here you're going to see the athlete has the hand of his non-injured arm on the other side of the pulley, and this is going to be used to pull the injured arm up into some extension, which is again some of this range of motion. This is all done again in a controlled manner in order to not cause pain. The next exercise is going to be our upright stick elevation and abduction. You may recognize these as exercises done with dumbbells oftentimes, and this is done like a front raise, but instead of using weights, we're going to use something simple like a dowel rod. You can use a broom handle or a mop handle, or in this case, a cane, and this is going to utilize the strength of your non-injured arm to raise the injured arm up into some of that extension, but it's going to be more active because you do have to activate some of those muscles in order to be able to lift the arm. So we're going to see this done in front of the body. And we're not trying to hike the shoulders. We don't want to cause any pain. And then we're also going to use that stick to push the injured arm using the non-injured arm up into some abduction to get, again, that range of motion. So the next exercise listed is the shoulder retraction, or no money. I'm going to go ahead and find that. And here you're going to see the patient have their hands sitting out in front of them as if they have no money or asking for money, and they're going to draw their thumbs back towards the back wall as they pinch their scapulas together, and this is to get some of that external rotation, and then they will bring it back slow and controlled towards the again. You see his hands will come back together. The final exercise I have listed up here is a wall protraction and retraction, and in this one, the patient will use a wall to push against, to pull the scapulus away from the spine, or to protract, push, as well as use the wall as a brace so that they can retract and pull those scapula back towards the spine. And this is to work on strengthening those muscles that are responsible for that action, as well as getting some of that range of motion. The next phase is the one that has a timestamp, so we are at least 8 weeks post-op, because this is when the sutures and that rotator cuff have been healing long enough that some internal rotation should be possible. And you'll see that's in the lineup of exercises. But at this point, we are going to start into some strengthening, which requires some warm-up. So we're going to see some cross-body arm stretching as well as some stick stretching. We're going to see band exercises because bands are easily adjustable. They're sort of weight without being weight. We're going to see elevation and abduction, internal rotation, and upright horizontal rows using these bands. And then we're going to get into some weights, some dumbbells, as we progress into phase 3. And we'll see some shrugs, as we did before. Now we just added weight, and some supine protractions. All of this is with the goal in mind to begin strengthening the muscles around that rotator cuff. So here we go into the video, and we're going to get into some cross-body stretching, and I'm sure that you all have seen this before. The patient is going to take his injured arm across the body and using his non-injured arm, grabbing the elbow and just pushing it a little further. This is an active stretch so that he gets to use his own body. Next, we're going to see some stick stretching, where he's going to draw this stick up and down the back, and this is going to allow for some activation of that injured arm, as well as some stretching using the non-injured arm. As we get into some band exercises, you'll see that there are different colors as demonstrated here, and these are different weights or different strengths of bands that are based on their elasticity. So we're going to begin this timestamp, where we're going to see the patient has placed a band under their foot and is going to raise the hand holding the band up in front of their body with a locked elbow, and this is engaging those shoulder muscles. And then they're going to control it as it is released back to the ground. You'll also see he's going to draw it out to his side, and this is the abduction, and the same idea, locked elbow, using that shoulder and that deltoid to pull the band. Next, we're going to see some internal rotation with the band, as well as external. So we're going to attach a band to a wall, and we're going to pull in towards the body, only moving what would seem at that elbow without extending the arm, because we want to use just the shoulder, and then we're going to control it as we release it back towards the wall. The final band exercise is an upright horizontal row, and you'll see the patient attach again this band to a wall, and they're going to stand in front of it, but instead of locking the elbow, they're going to allow that elbow to extend and then pull back using the muscles of the back as well as the triceps as they shorten to pull the band back towards the body. Finally, we're going to get into some dumbbell exercises, and you'll see the patient has a dumbbell in their left hand, which is assumes they're injured, and they're going to raise their shoulder up towards their ear as before and control it as it goes down. We don't want to see any hiking, and we don't want to cause any pain. The final exercise is a supine contraction, where the patient is laying on their back, or supine, and they're going to push a weight away from their body and protract their scapula forward. Now we're going to move into the final phase, and this is anywhere from 10 weeks to 12 months. This is where we see some real strengthening, and this is where we get into the advanced for the athletes especially. We're going to see wall slides, external rotation as before, stick strengthening as we saw as before, dumbbell exercises, as those elevations and front raises. So instead of doing them with a band, now we're going to see them done with weight. We're going to see external rotation and internal rotation also done with weights, and posterior raises, which I will show you since we haven't gotten into those yet. The goal overall is to build strength and begin to add sport-specific activity. So the posterior raise is what's seen. You're going to see the athlete has a weight in either hand, and they're going to let the arms drop towards the front of the body and then use the muscles in the back to pull those weights back towards the back body. This concludes our rehabilitation phases, and we just need to remember that no two people are ever going to be the same, so treatments are always going to be a little bit different. These are my resources. Thank you all for tuning in and listening to me speak, and I hope you learned something from this video.